morning, Miss Mackenzie. My name is Hailey. I'm going to be your nurse today. We're going to be doing some vital signs and just doing a head-to-toe assessment just to make sure you're healthy all around. Okay. Can you confirm your name and date of birth for me?
Kayla Mackenzie, 4/20/01.
Okay. I'm just going to get my stuff ready first and then we will get going. I'm going to verbalize that I would clean my stethoscope and the blood pressure cuff, the pulse ox, and anything I would be using to touch the patient. Okay, I'm going to start with your blood pressure. You know what your blood pressure is on average?
It's usually around normal, like 120/80.
Okay. Does that feel okay?
Yes.
Okay. Would you hold this for me? 122/76. Now I'm just going to assess your pulse. Okay, your pulse was 84 and your respirations were 18. Are you in any pain?
No.
Okay. I'm going to assess your O2 level. .98. I would also assess her temperature, but we don't have a thermometer here. Okay, Miss Mackenzie, I'm going to start off by assessing your neuro function. So can you tell me your name, date of birth, where you are, why you're here, what year it is?
Yes, I am Kayla Mackenzie. My birthday's 4/20/01. I'm in School of Nursing, and I'm here for a annual physical, and it is the year 2021.
Okay. And then I'm going to start off by assessing your sensory function. If you will just close your eyes and tell me whether you feel something that's soft, sharp, or dull.
Okay.
Okay?
Soft.
Okay.
Soft. Sharp. Dull. Sharp. Dull.
Okay. Perfect. If you'll just take your hands and rotate them over on your legs. Okay, perfect. And then if you will take your fingers and then just touch them to your thumbs. Okay. And then if you'll take your finger, touch it to my finger and then back to your nose. Okay, perfect. And then if you will take one of your heels and run it down the shin of your other leg. Okay, and if you'll do it again. Okay, perfect. And if you will stand up, we're gonna test your balance. It's called the Romberg test. So if you'll just stand there, close your eyes, and try to keep your balance. Okay, and then while you're standing, I'm gonna get you to walk in a straight line, heel to toe. Okay, perfect. You'll sit back down. I'm going to do a test called stereognosis. I'm going to place something in your hand and tell me what it is.
A pen.
Okay. And then I'm going to do another test. It's called the graphesthesia test, and I'm going to draw something in your hand and just tell me what it is, okay?
B.
Okay, and the other hand?
M.
Yes. Okay, and now I'm going to assess your deep tendon reflexes. So I'm going to start off with your patellar reflex. Okay. Okay, and then I'm going to do your radial and your brachial, and then your triceps. Okay, and do it on this side. Okay, next I'm gonna assess your hair, skin, and nails. I'm gonna put on some gloves really quick. Okay, I'm just take a look at your hair, note the texture, see if there's any lesions, masses, anything like that. Do you have any tenderness?
No.
Okay, I'm gonna palpate your cervical nodes. Have any pain back here?
No.
Okay. I'm going to palpate your lymph nodes in your neck. Okay. I'm going to see, can I see your hands? I'm going to test your capillary refill. Good, less than 3 seconds. Your nails are short and clean. I'm going to assess your skin. I'm going to assess your skin turgor. Okay. Perfect. Not dehydrated. You don't have any scars on your skin, no lesions, moles, or anything?
Nope.
Okay. And then you don't have any edema, so that's great. Okay, Miss Mackenzie. Now we're going to test your vision. So if you'll just stand up, and this is about 20 feet away, and cover one of your eyes and read the lowest line up there.
P3GDCK.
Okay, and if you'll do it with the other eye.
Okay. P3GDCK.
Perfect. That is 20/20 vision. I'm going to assess your eyes. So I'm going to check for pupillary constriction. Okay. Okay, your pupils are round, equal, reactive to light. Okay, and if you can just follow my fingers, it's called the confrontation test. Okay, now I'm going to test for accommodation to see how well you focus on something. Perfect. Now I'm going to assess the conjunctiva and sclera. The conjunctiva is the pink part of your eyelid. Sclera is white. Conjunctiva is nice and pink. Eyelids aren't swollen or anything like that. Okay. I'm going to test for your peripheral vision. So just tell me whenever you can see my fingers.
Now.
Okay.
No.
Okay. And then now I am going to assess for your hearing. This is called the whisper test. So if you'll close your left ear and just tell me what I say.
M.
Okay, and the other ear?
B.
Okay. Your hearing is intact. I'm just going to check for earwax. It's called cerumen. And any lesions on your ears. How many piercings do you have?
Got 3 in my right ear and 2 on my left ear.
Okay, no lesions, no redness or anything on your ears. Your head is normocephalic. It just means that normal shape, normal size. Is it okay if I pull down your mask to assess your nose? Okay. Okay, your septum's midline, no drainage. I'm gonna palpate your sinuses. Have any pain, tenderness? Nope. Okay. Any pain or tenderness here? Nope. Okay. And then I'm gonna assess your trachea. It's midline. Assessing for your lymph nodes again. Okay. And then I'm going to assess your thyroid, so if you'll just take a drink. Okay. No signs of goiter. And then I'm going to verbalize how I would assess her mouth because of COVID. I would check her lips to see if there's any cracks, dryness, lesions on her lips. I would check her buccal mucosa. I would assess her tongue, all sides of it, under it, just to make sure there's no canker sores, swollen tongue, anything like that. I would assess for her tonsils, note the size, if they're swollen, if there are like white spots or red spots on the tonsils, and then I would assess her uvula to make sure that it is midline. And then I would also assess her gag reflex to make sure her hypoglossal, glossopharyngeal nerves are working correctly. Okay, Miss McKenzie, I'm just going to start by palpating your pulses. Radial and brachial pulses were +2 bilaterally. Then I'm going to listen to the apical pulse. Okay, your apical pulse was 74. I'm going to feel your tibial pulse. Okay. +2 bilaterally. I would also assess her femoral pulse bilaterally, her popliteal pulse bilaterally, and her pedal pulse bilaterally. I'm assessing for clubbing, no clubbing present. I would also assess for jugular vein distension. And now I'm going to listen to your heart at the aortic, pulmonic, Erb's point, mitral, and tricuspid locations. S1 and S2 were audible and were normal rhythm. No irregular rhythms like AFib or anything like that. I'm gonna assess for a bruit in the carotid artery. If you'll hold your breath for me. No bruit present. I'm gonna palpate the carotid. +2 bilaterally, not bounding or irregular. No edema present on her body. Now I'm gonna assess your breath sounds. I'm gonna start by listening to your posterior. We'll just take some deep breaths for me. Breath sounds were clear and regular rhythm. I'm gonna listen up here. No adventitious breath sounds clear and regular rhythm. I'm going to assess for tactile primitives. I'm going to start in the posterior. If you could say 99 for me.
99,
Again.
99,
Again.
99,
And again.
99,
Okay. I'm going to assess in the interior. If you'll say 99.
99,
Okay. Now I'm going to assess for symmetric chest expansion. So if you'll just take a deep breath. Okay. Symmetric, I'm going to assess in the posterior as well. Take a deep breath for me. Okay. Looks good. Symmetric chest expansion in the anterior and posterior. I'm going to percuss your chest. Okay. Okay. Percussion was normal, assessed for resonance, no masses or dullness anywhere. Now I'm going to assess your musculoskeletal system. So if you will take your arm and flex and extend it, and then up and down, and then circumduction. Okay, and then the other side. Up, down, circumduction. And with your wrists, if you'll do this, side to side, and around. Okay, and then if you will extend your knee and flex it, and the other leg. Okay, and if you'll just roll your ankle around. Perfect. And if you'll stand up for me and just have your hip go out to the side and in, and then up and back. And if you'll do it with the other side as well. And then, okay, perfect. You can take a seat. And then if you'll hold your arms out, and I'm gonna push, but don't let me push your arms. Okay, perfect. I'm gonna pull and pull. Okay, same with your legs. Don't let me push. Okay, don't let me pull. Okay. And then I'm gonna assess your TMJ joints. If you'll open your mouth. Okay, perfect. And if you'll just clench your teeth for me. Okay, perfect. And if you'll just move your head this way, down, and back, and around. Okay, any pain or tenderness?
Nope.
Movements were purposeful and symmetrical. Her strength was normal. She resisted when I tried to push and pull against her. So that was good. I'm going to assess her thoracic and lumbar spine. Okay, if you'll stand up for me and just bend over. Okay, no signs of kyphosis or lordosis. If you'll lay back on this table, I'm going to listen to your bowel sounds. Okay, abdomen is not distended, not protuberant or anything. It looks flat. I'm going to listen to bowel sounds in all 4 quadrants, starting in the right lower quadrant. Bowel sounds are normal active. I'm going to percuss her abdomen. No signs of abnormal dullness. I am going to palpate for bladder distension. Bladder does not feel distended. I am going to light and deep palpate. Is there any pain or tenderness? Okay. I'm going to deep palpate in the right upper quadrant for the liver. And in the left upper quadrant for the spleen. Spleen is not palpable. I'm going to palpate for the kidneys. Kidneys are non-palpable. I'm going to assess for an abdominal bruit. The bruit is not present in the abdominal aorta. You can sit up for me. Are you experiencing any gas pain or nausea?
Nope.
When was your last BM?
This morning,
Okay. Well, and the consistency, was it hard, loose, normal?
normal.
Okay. Do you have any experience with constipation? Have you had that before?
Like after surgeons.
Okay. All right. And then do you have any trouble urinating?
Nope.
Okay. And can you state the consistency of it? Like, is the color, is it clear, see-through? Is there stuff in it, blood?
I say like clear to yellowish.
Okay. And then do you have a history of UTIs or anything like that? Okay, perfect. Okay, well, thank you for your time, Miss Mackenzie. Is there anything else I can do for you?
No, that's it.
All right, thank you so much.
Thank you.